Hi, my name is Dr. Kaitlin Forestieri, and I am with the Levine Cancer Institute within Atrium Health. I specifically work within Psycho-Oncology, and today I would like to talk to you about the emotional toll of cancer. So when you hear those words, I'm sorry, you have cancer, there are a multitude of reactions that you may have in that moment. Okay, some fairly common reactions include shock, denial, bargaining. You may recognize those first three as being closely associated with the grief process, and it is very likely that you will be experiencing grief throughout the process of your diagnosis and treatment. Grief does not have to mean explicitly the death of a person. It can also mean the death of a role, the death of dreams, the loss of goals, etc. You may experience hopelessness. um, I can't survive this. How am I going to get through this? Perhaps somebody in your family died from cancer, maybe even the same cancer, and it makes you feel like I'm not going to be any different. So you immediately might lose hope. Dissociation, or the disconnection between your mind and body. Things around you might feel like they're not real. This isn't really happening to me. This feels more like a movie. This happens to other people. Um, it feels fake. It might feel like you're having an out of body experience, watching yourself from another point of view, or just that you've disconnected from your body and you're going through the motions, but your mind just isn't really there. Or you may lean into the busyness of your schedule now. For those of you who have received a cancer diagnosis, I'm sure you realize at this point how quickly your schedule fills up with appointments. So you get busy and you stay busy fast. And in so doing, it becomes much easier to ignore the emotional reaction that you're having to your diagnosis by focusing on the logistics. As time goes on and you begin moving through treatment, you may be diagnosed with what is referred to as an adjustment disorder. Now, in the context of oncology treatment, an adjustment disorder essentially means that you are having a reaction to an uncommon situation. So we introduce this uncommon, foreign experience of a cancer diagnosis. And now all of a sudden, you're experiencing levels of anxiety, depression, or maybe even both that you did not experience prior to your diagnosis. All of a sudden, you find yourself incredibly anxious, incredibly sad, maybe both. Okay. So, this is a change in your functioning that has occurred only within the context of cancer. It's also possible that you have a pre existing history of depression or anxiety. And the cancer diagnosis has now exacerbated those those experiences for you. So perhaps you've already been diagnosed with major depression, and perhaps you're not in a current episode until you receive your diagnosis. And now all of a sudden you find yourself crying, you find yourself feeling sad, recurrently thinking about death, experiencing that hopelessness that we were just talking about, and you find yourself now again in a major depressive episode. Or perhaps you have a history of anxiety, but maybe it's only really been related to your job. Now, all of a sudden, you find that anxiety has infiltrated other aspects of your life, and now largely you're anxious in general. You find yourself worrying constantly. Maybe you're having a hard time sleeping because you can't shake the what ifs. Um, Perhaps you find yourself tense and irritable. And so now, something that you might have already been experiencing to some extent has become a much larger issue in your life and has caused a greater difficulty with your functioning. Perhaps, again, it's both. You may also develop panic disorder. So, what can sometimes happen is somebody develops or has a panic attack because of their anxiety. All of a sudden, they feel like they're having a heart attack. They're having a hard time breathing. Their heart is racing. It feels like it's thumping out of their chest, and they're sweating and they feel hot. Or maybe they feel like they just got ice cold water poured down their back. They have stomach upset and their head hurts, and suddenly they're worried that they're dying because it feels in the moment during this panic attack like you're dying. So that's a pretty scary experience. It doesn't last forever, it doesn't last very long, even. But because it's scary, folks become afraid that they're going to have another one, that it's going to keep happening. And sometimes panic attacks become tied with the event or the location or the person who's with them when their panic attacks occur. So if your first panic attack is in your doctor's office the day of your diagnosis, then you may be afraid that if you go back to the doctor, you're going to have another panic attack, and so you don't go. Or maybe your first panic attack is in the CT machine. And so afterwards, you become convinced that if I have another CT, I'm going to have another panic attack, and I can't do it. This obviously creates significant difficulties with functioning because you're not able to engage with life in the same way. There are things now that you're avoiding for the sake of hopefully avoiding a panic attack. Now, I will tell you that that doesn't work. You're going to continue having panic attacks no matter what you avoid. And so you just lose more and more of the outside world over time. Now, some less common reactions, and by less common, I mean these are just things that we don't see as frequently, but we do see these reactions, okay? So again, you're responding to an abnormal, probably very scary situation. So whatever reaction you have is the reaction you have. This may include obsessive compulsive disorder, which thankfully has gotten a lot more recognition in recent years for what it actually is, rather than, just being the stereotype of somebody who's a clean freak or is obsessed with hygiene or is, quote, a germaphobe. Obsessive compulsive comes in many, many different shapes and sizes, and so sure, it may include fear of germs, but it also may include other things like rituals that you need to do before you go for your scan so that you get good results. It may include having to wear a specific outfit when you go visit your doctor because it makes you feel safe. And if you don't wear it, you think something bad is going to happen. It may include contamination fears. You might be afraid that you're going to spread or infect somebody with your cancer, even though you know and I know the cancer is not contagious. Okay, OCD does not operate based on logic. You may develop agoraphobia, which is commonly thought of as the fear of leaving one's home. Agoraphobia really is the avoidance of public places where there may be large crowds, where you might have to stand in line, public transit, such as a bus, a train, a plane, etc. Due to fear that if something bad happens, you're not going to be able to escape. Okay? You won't be able to get away from the bad thing. These situations may be tolerable if you're with your safe person, somebody who you've identified, hey, this person makes me feel comfortable, bad things don't seem to happen when they're around, so I can go on this airplane if they're with me. But if they're not with me, I can't and I won't. You may develop a specific phobia. Now, agoraphobia is an example of a specific phobia, but this may also include claustrophobia, which I think is honestly fairly common when it comes to scans, right? So the fear of being in the MRI machine because it's so closed off, or fear of receiving radiation if you're a head and neck cancer patient because of the mask that you have to wear. Could become fear of needles, fear of blood, because of all of the different times you're getting your blood drawn, injections you're receiving, infusions you're receiving, perhaps even your port. And then once we move into post-treatment, so you've received the news that you are cancer-free, you're in remission, you're cured. Well, often what can happen is a fear of cancer recurrence. Now, this mimics PTSD very closely. There's a few key differences, one of which being we can't actually diagnose fear of cancer recurrence the way that we can diagnose PTSD, but in the way that it mimics PTSD, you find that you're having recurrent anxious thoughts about the possibility of cancer recurrence. What if it comes back? What if I get sick again? What if I get a different kind of cancer? The what if thoughts start running rampant through your brain. And so you might start engaging in body scanning. Does anything feel weird today? Does anything hurt today? Does anything look weird today? I have a headache. Does that mean I need a scan? Do I need an MRI? Where did this bruise on my leg come from? I don't remember hitting it. Do I need blood work done? It might also include physiological arousal when you're confronted with cues. Another way to say this is that when something reminds you of your trauma, or something reminds you of your cancer diagnosis, treatment, symptoms, etc., you become overwhelmed with fear. Okay, and this might look a couple different ways. So let's talk about some examples. So perhaps the hospital in general has been associated with your cancer diagnosis for you. And so when you pull into the parking lot and you look at the front door, you become overwhelmed with this sense of, I can't do this, I don't want to be here, I have to go. It could be the smell of a specific soap, right? We all know that hospital soap has a specific smell. And so maybe you're not at the hospital, but you're at your kid's pediatrician and they wash their hands before they do, a physical for your child. And just the smell of that soap, boom, you are overwhelmed and maybe you start having a panic attack. Maybe you no longer can focus on what the doctor is saying because you've gone into that dissociative state. Now, none of this probably sounds like very much fun, which results in one of the symptoms of PTSD, which is avoidance. Okay. In order to avoid feeling those ways, you avoid the situation, the cue that prompts those things. So you stop going to the hospital or you stop wearing a specific kind of perfume because it was what you were wearing the day of diagnosis. Or perhaps you stop getting physicals because you don't want to know if something's wrong. Another fairly common reaction post-treatment is this sense of loss of meaning, direction, or identity. Okay. So, a common way that this can come up is the opposite of what we talked about being a common reaction to diagnosis, which is when you become very, very busy at the start of treatment. But at the end of treatment, folks have described this like they've been running at full speed and how now have suddenly run into a brick wall. Everything stops. Your calendar is suddenly no longer full of doctor's appointments every day. And so now you have all of this time to sit with your emotions, with your feelings. And that by itself can become incredibly overwhelming. What do I do now? Who am I now? It could be that a piece of you that was tied very closely to your identity was also tied to your cancer, and now it's gone. So this may look like somebody who's always been very athletic and has enjoyed playing sports or has enjoyed working out, being diagnosed with bone cancer and subsequently having an amputation and no longer being able to engage with that sport or with that hobby in the way that they used to. Okay, so now maybe there's an adaptation that needs to be used, or maybe you choose not to engage in it at all. Similarly, perhaps a woman her whole life has wanted to be a mom and has planned out the names for her kids, her future kids, and then all of a sudden she finds out that she has ovarian cancer and needs a total hysterectomy. And now she's lost the ability to have treatment. What does she do with her life moving forward after the cancer's gone? So the good news is that there is help for all of the reactions that we've talked about and any reaction that you're experienced that I didn't mention. Because like I said, any reaction to a cancer diagnosis and treatment is understandable. It makes sense. This is an incredibly scary and overwhelming time. So when we're talking about getting help, it's important to talk about who can help. So I would say your first line of resource is the Psycho-Oncology team at Atrium Health. Again, I am the psychologist within the Psycho-Oncology team at the Moorhead specific location within Atrium. But we also have licensed social workers, we have licensed marriage and family therapists, we have licensed mental health clinicians, we have psychiatry, we have nurse practitioners, we have a full gambit of folks that are happy to help with your mental health, help with the exploration of what does it mean to be diagnosed with cancer and what does it mean to move forward. We do have folks at other satellite locations, including Pineville. Um, Pineville is probably one of the more popular, but also University, etc. So if you have a question about whether or not there are resources available to you at a specific satellite location, please feel free to reach out to us. We also are able to do telehealth. So even if there is not a satellite location very close to you, as long as you are in a state where we have somebody who is licensed, we can do telehealth with you. Okay. Um, but perhaps you're somewhere that is too far from a physical location and your Wi-Fi is terrible, and so you can't make it to Atrium for our psycho-oncology team. Well, I would also then encourage you to reach out to psychotherapy providers in the community. And specifically, I would really encourage you to find folks that have experience and training specifically in working with cancer, okay? Because there are very unique considerations for folks that have been diagnosed with cancer. And they are out there. You will be able to find a doctor of psychology, a PhD, doctor of philosophy, licensed social worker, licensed mental health clinician, licensed marriage and family therapist, anybody with a degree in mental health who has training and experience working with cancer. They are out there. They do not only exist within the healthcare system. You just have to look. One good place to look might be Psychology Today. Might also be okay to just Google psychotherapy providers near me. There's also psychotropic providers in the community. And again, I would really strongly encourage you to find somebody who has experience co-prescribing with oncology medications if you are still on treatment, okay? And included with the oncology medications, I would say, is the pain medication you may be on. Different medications are going to have different interactions and reactions to one another. So I think it's important to find somebody who is comfortable working with a complex medical history and with somebody who likely is taking more than one medication, being honest, okay? A psychotropic just means that it is medication that is prescribed specifically to help with your mental health. So folks that are qualified to do this include an MD, a DO, nurse practitioner, physician assistant, anybody in the medical field that is able to prescribe medications. This may even look like a doctor of pharmacy. Again, if you can't make it to Atrium, I really strongly encourage you to find somebody who has experience working with oncology patients. Okay. But the bottom line is that there is help out there. Whatever reaction you're having, you don't have to go through it alone. And the benefit of reaching out to a neutral third party, such as the psycho-oncology team here at Atrium, is that you don't have to worry about protecting us the same way you may be worried about protecting your friends and family, or the same way that you may be worried about burdening your friends and family, which that also is a wonderful reason to come in and talk, is if you feel as though you've become a burden. Okay. So I appreciate your time. Um, and I hope that if this has been helpful, that we will see you here at Levine Cancer sometime soon. Thank you.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.